for the community as a whole, it's a major step for spreading the care and increasing the amount of time that any care provider can spend with the patient and giving them the tools, the patient the tools to be able to care for themselves, and empowering them is going to be major. And as far as the student body goes, they're just as much the community as anybody else is, and so we welcome everybody here.
And how about for the students that are actually in the program that have the opportunity to, I guess, have a more practical side, would you say?
Yeah.
What they're learning here?
As far as I know, they will be, the nursing students that are going through clinicals right now will be taking rotations through the clinic. I'm not sure how many hours a week, but definitely some practical experience. It's an interesting experience because they'll get to see a outpatient clinic versus the hospital setting or the health unit or anywhere else in the community, where just because of the education that's involved with the patients and the care that's involved. So.
Right. And I understand, you're graduating, but you're going to be working at Cabrini, but you're still going to put in time here. Why is it important for you to be involved in what's going on here?
The education is the major part, and being able to connect with a person, not just in the acute care setting in the hospital, but also here where they are going to appreciate the tools. And we may see patients in the hospital come back in a month or two, and here it's more about preventing everything from happening so that they don't have to be admitted into the hospital and they can feel like they're being cared for. And having that connection with the patient is so much more important to me than anything, and being able to experience both sides of that in the outpatient care clinic like here or in Cabrini in the inpatient care clinic setting is going to be that's my main focus. So that's my main motivation for everything. So,
I mean, how exciting is it to be a student, to be part of something like this, to see a program that's really growing and developing, and seeing kind of the vision maybe that someone like Dr. Sharp has actually coming to fruition? Yeah.
It's weird not being in school and being a part of this. I'm not in clinicals. I don't have to address them as professor anymore. But I'm extremely honored that I was able to have this opportunity to work with them, and my professors and the dean herself, they're incredible people, and I look up to them so much. And so being able to help them here and work alongside them is going to be very interesting, very weird at first, but it's going to be extremely powerful. So.
And as you know, a lot of the focus here at Louisiana College is the integration, faith, and learning. How do you see as a student this will be an opportunity for those students to put that into practice, or to actually have that practical side of it?
Being able to, pray with the patients, and that's something I've seen in the hospital with my classmates, is the patients are extremely appreciative. It's not all every day that you get to see a nurse that expresses a spirituality, and so spiritual care is just as important as physical care or emotional care or anything within the holistic vision of a person. So here they're going to be able to practice that just as much as in the hospital, and so which is a lot, and which is wonderful. So
very good, man. Thank you.